Say what? Saquon Barkley's out? Did you know that there's a Peppa Pig video where they got him swearing?
What are you doing? You weren't fucking invited.
Someone made a mock Peppa Pig video. So Saquon Barkley, as you can see, knocked his ankle out.
Down upcoming bad news, Giants fans. Saquon Barkley hit and injured on this play. He has been knocked out of the game.
And it's called a high ankle sprain. So what the is a high ankle sprain? Hey, no swearing. Kids are watching, no swearing. Which, by the way, actually, did you know that there's a Peppa Pig video where they got him swearing?
What are you doing? You weren't fucking invited.
Someone made a mock Peppa Pig video. My daughter loves Peppa Pig. All of a sudden I start hearing the F word. Okay, so back to Saquon Barkley. So Saquon Barkley has a high ankle sprain. What is it? So, I know, I got lousy sound effects. This is your ankle, right? Right here. There's your ankle, this is your foot, this is a little floppy foot here, but your ankle is this joint here, okay? And it's made up of the talus, which is the bone right here, part of the hind foot, and then you have your tibia and your fibula, okay? This is going up to the leg, outside, inside, okay? That's your leg, and this is a right ankle foot. Okay, so the ankle, when you go up and down, when you walk, that's this joint. It's the tibio-talar joint, also including the fibula. And within the tibio-fibular part of the tibio-talar articulation, you have what's called a syndesmosis. So that means there's a ligament between these two bones. And it's actually sitting in this junction right here, okay? It's not this little floppy rope ligament there. It's actually a ligament between the tibia, the lateral part of the tibia within this groove right there, and the fibula right here, just above the joint. So it's in this area right here, okay? So if I stabilize that, it's right across there, and there's an anterior one, posterior one, that goes across the syndesmosis. So now traditionally ankle sprains happen here. You have your medial deltoid ligament, you have your anterolateral talofibular ligaments and your fibular calcaneal ligament. Now those are on this side, distally in this area. And those are the ones you turn your ankle this way, turn your ankle that way. But sometimes when you land, you turn in such a way that it's not these ligaments that tear, or they could, but they also splay the tibia-fibular joint. When that happens, you get a disruption in this part of the ankle called the syndesmosis. When that's disrupted, that's a high ankle sprain. Now that's different from a high grade ankle sprain. This is a high ankle sprain, not that kind of high. It's legal. It is legal. Well, in some states. So high ankle sprain, so it's not down here, it's not down here, it's higher up. So that's why it's called a high ankle sprain, okay? Got it? Now, what does that mean? Now, if you have a disruption of this joint, it can be very subtle. I've had some patients show up with treatment for chronic ankle sprains. They never get better. And then you do a stress view or an MRI. And sometimes the MRI, if they're showing up late, the MRI doesn't show anything. The alignment's okay. Then you put them in a stress view. And when you stress the ankle, that's when you see the separation in this manner, such that there is a separation of those two bones. What that means is that if there is a disruption there, the ligament needs time to heal. And if you can't get the alignment stable, it sometimes needs surgery. Now, we don't know at this point whether he's going to be having surgery. We don't know the extent of the injury. Was it a complete disruption? What was the separation? Was there a cartilage injury? Was there an associated fracture? Was there other associated injuries with that? Or was it just an isolated high-grade ankle sprain, which is a syndesmosis injury? We don't know all the particulars and the details. However, in the area of the ankle. If you treat a syndesmosis, you have to treat it stable, often with casting, or a very stable boot with the air bladder, so you have a nice conformed fitting. Or you could do a 3D printed cast, 3D printed brace. That way it gives you nice form fitting for your ankle. And once it heals, it can take 6 to 8 weeks, you can then start rehabilitation. Now, sometimes these don't always heal. And if you have to stabilize it, then you have to stabilize across this joint. And usually that's done, well, traditionally, historically, back in the old dinosaur days, we used to put screws across there. Now we use ropes and sutures and special implants that we now stabilize across this joint. There is cartilage in this joint, so you don't want to crush that space, and you don't want to tighten the ankle mortise either. So you do have to be careful when you are repairing these syndesmosis injuries, but there's all sorts of different treatment options, and as this injury evolves and we get further information, we'll keep you up to date.